those amendments and like trying to say what they.
We can start?
I'm gonna have to figure out how to shorten that description. It's gonna be something like.
All right, good afternoon. We're gonna get started. On voting list number 6, today is Wednesday, March the 15th. And may I have a motion on the withdrawal, please? Second, any opposition? Yes. Okay. So let's just start, 1 second. We are live. We are live. Those at home, just be patient with us. Oh, thank you. Thank you. Okay. I want to start, good afternoon, by saying thank you to Michelle and the staff for their hard work, because they're putting those packages that you have in front of you with the help of the LAs and all the emails that she sends you every single day as well. And text, I want to say thank you so much. Couldn't do it without you guys, okay? So on the withdrawals, there was a motion, a second, no opposition. Move to, all those in favor say aye. Aye. Any opposition? Seeing none, let's start with House Bill 121, Mental Health Treatment Plans for Individuals in Facilities Requirements. That was favorable with amendment, and that is Aaron and Delegate Kerr.
The bill codifies existing regulatory requirements for the development, review, and reassessment of a patient's plan of treatment and establishes new requirements related to a patient's plan of treatment. There were amendments that begin on page 1 that were adopted in government operations and health facilities. The amendments require facilities to provide a schedule of team meetings where a plan of treatment is discussed and establish a process for authorized individuals to participate in treatment team meetings when an individual consents to the inclusion of family members. The amendments also alter the process to be followed by a facility when communicating the results of a review and reassessment of a treatment plan, and it strikes the Office of Administrative Hearings Review from the bill.
Delegate Kerr.
Thank you, Madam Chair. The amendments made the bill agreeable to all parties, and we adopted them in subcommittee. The bill passed subcommittee unanimously.
You want to move the amendments?
Let me move the amendments, Madam.
It's been moved in second. Any discussion on the amendments? Delegate Riley.
I'm sorry, so,
No, sorry,
Thank you.
just, this is the place to ask the
so
questions.
Delegate Kerr, do these amendments suffice and alleviate the opposition or issues that the Maryland Department of Health and Judiciary had?
An issue with this one? They had an issue with the deaf and hard of hearing one, but I don't remember.
Okay, I have it on here.
Aaron is going, yeah.
They're fine, both?
Yes.
Thank you.
Thank you for the question. And thank you, Delegate Kurt and Aaron. So any other discussion on the amendments? All those in favor say aye. Aye. Any opposition to the amendments? On the bill as amended, may I have a motion? It's been moved in second. Any discussion on the bill as amended? All those in favor say aye. Aye. Any opposition? Seeing none, who does not want to be on the bill? Raise your hand. Everyone wants to be on the bill. Oh, you? Okay, so Delegate Riley does not. And Shalega and Morgan. And who else? On House Bill, the House Bill we're discussing right now is House Bill 121, is the mental health treatment plans for individuals in facilities requirements. Everyone is on board, and we are at the part of, who does not want to be on it. Can you please just raise your hand for me? Who does not want to be on 121 so that I can call it Delegate Shalega, Delegate Chisholm, Delegate Morgan, Delegate Riley, Delegate Hutchinson. Okay? Did you get that? Yeah. Did you write that? Were you able to get that? Whoever's writing it? Okay, beautiful. Thank you. Thank you very much. So next, we have actually House Bill 260, Maryland Sign Language Interpreters Act, that is favorable with amendment. It is Lindsay and Delegate Kerr.
This bill establishes a regulatory framework for the licensure of individuals who provide sign language interpretation services in the state. The State Board of Sign Language Interpreters is established in the Office of the Deaf and Hard of Hearing. Beginning January 1st, 2025, an individual must be licensed by the board before providing sign language interpretation services in the state. The Sign Language Interpreters Fund is established to collect associated revenues and pay for the board's costs. In fiscal 2025 only, the governor must appropriate $100,000 in general funds to the board, and subject to the evaluation and reestablishment provisions of the Maryland Program Evaluation Act, the board terminates July 1st, 2033. There are amendments on page 6 in your packet that require the Office of the Deaf and Hard of Hearing to include in its annual report a report on the activities of the board, including the number of licensed sign language interpreters and number of complaints received, differentiated by the type of complaint, corrects a typo in the bill, and requires the Maryland judiciary to submit a report to committees on its use of interpreters for 3 years beginning January 1st, 2026.
Delegate Kerr.
Thank you, Madam Chair. First of all, I want to thank the bill sponsor, Delegate Bagno, who worked really hard on this bill. But still, despite all of her efforts, the Maryland judiciary is still not happy with the bill, and they never will be happy with the bill. But the deaf community in Maryland needs some relief, as they are not being adequately represented in the Maryland's courts in too many instances. We passed the amendments in committee, and we passed the bill out unanimously. So I move the amendments, Madam Chair.
They've been moved in second. Any discussion on the amendments? Delegate Morgan? No? Seeing no discussion, all those in favor say aye. Aye. Any opposition? Seeing none on the bill as amended. Move the bill as amended. It's been moved in second. Any discussion on the bill as amended? Delegate Morgan? My pleasure.
I want to congratulate the bill sponsor. I know she did a wonderful job putting this together. But some of us, including me, are concerned about licensure as an artificial barrier to employment. So unfortunately, I'll be voting against the bill. But I did want to congratulate the bill sponsor. So
thank you. And thank you for the comments. I appreciate it. Any other concerns or comments? All right, all those in favor say aye. Aye. Any opposition, can you raise your hand? Delegate Morgan, Delegate Chisholm, Delegate Shalega. All right, thank you. Let's go to, who does not want to be on that bill? Can you raise your hand? Delegate Shalega, Delegate Chisholm, Delegate Morgan, Delegate Riley, Delegate Hutchinson, and Delegate Kipke. Thank you. Now we're going to House Bill 274, which is Task Force on Reducing Emergency Department Wait Times. Favorable with amendment, it is Aaron and Delegate Kerr.
This bill establishes the Task Force on Reducing Emergency Department Wait Times. There are amendments in your packet beginning on page 8 that were adopted in Government Operations and Health Facilities Subcommittee. The amendments add members to the task force. It goes from 7 to 21 members now. It requires the Maryland Institute for Emergency Medical Services Systems to staff the task force, requires the task force to identify root causes of wait times in emergency departments, including an analysis of health system capacity, healthcare workforce supply and unmet need, changes in acuity over time, and the availability of post-hospitalization care options to coordinate with other state commissions, review studies and recommendations on addressing workforce capacity, conduct an analysis of reimbursement policies, and make recommendations including legislative, regulatory, and other policy initiatives.
Delegate Kerr.
Thank you, Madam Chair. First, I want to thank Erin for all her work on this bill. We met several times with MedChi and the Maryland Hospital Association. We worked out an agreement, and we were also able to accommodate an amendment, and through some clever work, we kept the group at a manageable size at 21. So we adopted the amendment. Everybody wanted on this bill, so there's still going to be people who are not happy that they're left off of this task force, but I think we got the best product we could. So we moved the amendments unanimously in subcommittee, and I move the amendments now, Madam Chair.
Is there a second? It's been moved in second. Any discussion? Yes, Delegate Kipke.
Thank you. One of the advocates who advocates most strongly for the bill expressed some disappointment at the way it's constructed. And I wanted to circle back and talk to her about it because there are so many issues outside of the ER that cramp up the ER. You know, homeless folks that end up staying in our hospitals, taking up a bed, individuals with youth with mental health issues where there's no place to transfer. I mean, there's a long list of reasons why this is happening. So I just want to compliment the chairman of the subcommittee and the bill drafter. This is a fantastic product. It's a long time overdue, and I'm sure that these hospitals are chomping at the bit to start talking about the problems that they're facing, and it's one of the most important things I think the committee will have done this year. Thank you.
Well, thank you. Really appreciate your feedback. And congratulations to all those involved, all your hard work. Any other, Delegate Bandari?
Yeah, thank you, Madam Chair. Yeah, thank you, Delegate Kipke. I think you are referring to Palmageno, right? I had a conversation with her. As everybody agreed that it was heavily amended bill and very compromised bill, So, and I talked to her in a length that this is just the study bill, and based on it, we could have a best product in the years to come.
Thank you. All right, so where were we? Did we move the amendments? All right, we took a vote on that already, on the amendments, right? We were on the bill. Move the bill. All right, it's been moved in second. We had a discussion. All those in favor say aye. Aye. Any opposition? Who does not want to be on the bill? Everyone wants to be on the bill. Thank you. Thank you all for your hard work. House Bill 283, Maryland Medical Assistance Program, gender affirming, favorable with amendment, Aaron and Bagno. Aaron.
This bill requires Medicaid beginning January 1st, 2024 to provide coverage for gender-affirming treatment. There is a reprint of the bill in your packet beginning on page 11 that includes an amendment that was adopted in the Public Health and Minority Health Disparities Subcommittee. The amendment provides that the report to MDH from the managed care organizations to include certain information for each healthcare provider offering gender-affirming treatment with which the MCO has an active contract and who consents to the inclusion of being in that report, and also whether the healthcare provider consents to being publicly listed as part of the department's annual report.
Okay, Delegate Bagno.
Thank you, Madam Chair. We spent 2 subcommittees on this bill to make sure that everyone understood the bill, understood the concerns. We brought in clinicians to answer questions. We had a very robust and respectful conversation. Ultimately, the bill passed not unanimously. But I do want to thank everyone in my subcommittee for asking really important questions. I want to thank Erin for her hard work, and I want to thank all of the stakeholders and the bill sponsor for all of their work to make sure that we had the answers that we were asking for.
Okay. So this is the time where we come and we talk. I know that we have philosophical differences. This is a safe and respectful space. So I want to let you know that, please let us know how you feel. This is the place to have the conversation. So I'm gonna move the amendments first. I just want to set the tone, okay? But thank you. So on the amendments, please move the amendments so we can have the discussion. It's been moved in second. Now we're gonna have the discussion, and I'm gonna call on people the way I see them. First, I saw Delegate Hutchinson and Chisholm. And Morgan. And Shalega. Thank you. Go ahead.
Thank you, Madam Chair. 57 days ago, I came to Annapolis as a freshman delegate and somewhat of an ignorant delegate in terms of the transgender community. I truly didn't know what gender dysphoria was. I didn't know what gender-affirming care, quite frankly, was. And I took a lot of time to understand it and understand the issues. I met with the transgender team and the bill sponsor, because it's something I really wanted to understand and take that time. And I certainly learned a lot, and I understand the mental health issues that are faced with the transgender community. There was one part about this bill that did bother me quite a bit, and that was that there was no age restriction on terms of surgery. And I brought that up a number of times and was hoping that it would have been amended to address that. So I would have to be a no on this bill, but I just wanted to share that I certainly put a lot of effort into making sure I understood what this bill was all about. Thank you.
And I want to thank you for all the efforts that you put. I know that you did, and I know you were asking questions and reading, and I really appreciate it. Thank you for being diligent. I appreciate that. Next, I have Delegate Chisholm, followed by Morgan, followed by Shalega.
Thank you, Madam Chair, and I
My
will
pleasure.
agree that the subcommittee worked very respectfully, very hard to see if we could find some agreement. But since I was in all the subcommittee meetings, I wanted to just address the same thing that Delegate Hutchinson was talking about. My great pause is with the minors, and most importantly was some of the puberty blockers. And I think the thing that we can all agree on is this science is still evolving, and some of the procedures they're using, some of the pharmaceuticals they're using, are they really irreversible? I mean, I was looking at studies from London to all these different, in Canada, even in the United States, and a lot of it is still not confirmed science. It's not historically long enough for us to say that we should allow puberty blockers and some of these hormone-changing drugs to be administered in at such a young age. I understand the intent of trying to curb the suicide part, and look, we all are trying to stop that and doing whatever we can. I just still can't be convinced that any of this really does curb it, and that a lot of these things are actually reversible. And that was my greatest pause with it. I mean, once you're an adult, I understand what you want to do, but I'm just trying to protect some of the minors that might become damaged or hurt in this whole passing of this bill. Thank you, Madam Chair.
No, thank you, and thank you for expressing your thoughts and giving feedback about your thought process. We really appreciate it. Delegate Morgan, I think I said, followed by Shalega.
Thank you, Madam Chair.
My pleasure.
Yeah, this is a touchy subject because a lot of people that are against this automatically get called bigoted and other hateful things when you're really just concerned about people. And to me, gender dysphoria is a mental illness. I don't know if we're really confirming anyone's gender with this bill. A lot of times, especially on children, I feel we're confirming their dysphoria. And this is a Medicaid taxpayer-funded bill. So even if it would just apply to adults, it would be troubling because from a cost basis, we don't treat other people that are on Medicaid with the same level of service that we're going to now be treating people that are confirming their gender. I'll give you an example. If a woman needed a mastectomy because she had breast cancer, well, they would do the reconstruction. But under Medicaid, under this bill, well, you would do an augmentation. You're doing more for this than what a woman that maybe just was suffering from, feeling bad for herself and wanted to be more womanly. And then you add in the child portion of this. This is what really concerns me and people on my side of the aisle, because there's definitely something going on in our society. There's a Gallup poll, and I'm looking at it right now, that people identify as LGBT. And it goes back and looks at different generations. And it starts off with the traditionalist generation in 1946. And they identified LGBT at 0.8. Then the baby boomers are at 2.6, Gen Xers are at 4.2, Millennials are at 10.5, and then Gen Z is at a whopping 20.8. So I'm sure my friends from across the aisle will say, well, you know, we're as society, we're being more tolerant, and people are coming out. And that might be very well true, but at 20.8, it looks like there's something else going on in society that are driving children to those. And under the bill hearing, it was considerably upsetting when I was questioning the doctor that was on the sponsor panel. Now, the doctor said they would treat children as young as 9 with Lupron, with a puberty blocker. Lupron is a drug that was designed for males that were suffering from prostate cancer. This is an off-label use for Lupron. The other off-label use for Lupron is for convicted pedophiles in chemical castration. So I just think we're going 3 steps ahead from what we should be doing. We're treating children with harmful puberty blocking drugs before they go to puberty. There's been numerous studies out there that shows that, you know, while children may have gender dysphoria, might be something in society pushing them through, with counseling and just support, 85% would return to their gender that are assigned at birth. But almost 100% would stick with the gender reassignment if they're assigned puberty blockers. I think that when we look back 10 years from now, we're making a huge mistake today. So I hope everyone that respects that opinion, I look forward to hearing more of your side of the story. So thank you. Thank you so much, Madam Chair.
You're welcome, and we certainly respect, you know, your opinion, and we are grateful that you feel, you know, comfortable to express it, and we certainly will, you know, be respectful and appreciate it. Delegate Shalega.
Thank you, Madam Chair. And like Delegate Morgan, this is not personal to the advocates that are here today to watch our voting session and my colleagues. This is not personal. It is medical. And I went back and listened to the hearing, and it was said over and over and over, this isn't for minors. So it is for, I'd like clarification on that, because I read the bill, it is for minors. So what can you tell us?
Thank you. And I know Delegate Collison is she's taking notes, and she's going to be addressing all your points. So anything else, any other questions you may have?
Back and forth with this?
Yeah, it is. I just wanted to make sure to allow them, they didn't really have a question. They were giving us their view, okay? So that's why we haven't had back and forward.
Okay, I'm ready for back and forward, not my view.
All right, so now you're going to get your answer, all right?
I have a few other questions, but if we're going to, if this is the way, you know.
No, you have, Delegate Shalega, Delegate Hutchinson didn't have a question.
Right, no,
Delegate Morgan didn't have a question. Delegate Chisholm didn't have a question. You have a question, and I just asked Delegate Collison, will she address it? So just give us a minute.
Yeah, it's fine.
Okay. Thank
I'm
you.
not
And
trying
if
to
you have
disrupt
the rest of them, let her answer that one, and then you can give her the next one, okay?
Okay.
All right. Delegate Collison, please.
Thank you, Madam Chair. And I do want to thank everyone who's expressed their concerns and feelings about this bill. And it's very important for us to have these kinds of conversations. So the issue of minors, this bill does not change current practice. What is happening right now in Maryland is going to continue under this bill, which means that puberty blockers will be used on adolescents. That, and again, I need to be very clear under the conditions that these are used. It has to be with the child expressing their concern and demonstration of the gender dysphoria as defined by a physician and a mental health provider. So it's not just a 6-year-old boy saying, I feel like a girl. It's a 6-year-old boy who says, I feel like a girl, I don't know what to do, and the parents taking this child to the appropriate medical providers to have that child assessed in terms of the potential for gender dysphoria. The early part of treatment for younger children is essentially counseling, and lots of counseling, and also some social acclimation because, and socialization, because because these are children who sometimes suffer a lot of bullying. We heard about that this morning. And so they need to know that they are accepted. And that's the early part of the treatment for when children begin to identify that they're having concerns. But puberty takes you into another realm, right? That's where the body begins to manifest the physical elements of the physiological gender, biological gender. So if the child is experiencing dysphoria and their body starts to change in the way that takes them further into the biological sex that they don't feel right in, then that is what causes the emotional, even greater emotional distress. Puberty begins at different times for different children. Again, these young people are under the care of a physician, and parents are involved at every step of the way. And it's over time. Nothing will happen in a short period of time. And, you know, puberty blockers have been used for almost 50 years. We have a tremendous amount of experience with puberty blockers. There may be individual cases, as there are with any kind of medication, but in general, tens of thousands of people who have been on puberty blockers have been studied, and it has only helped them work their way through to becoming the fully actualized person that they can be. And the evidence, and there are several recent peer-reviewed studies that say adolescents who have access to puberty blockers are much more stable in their mental health than those who don't. And those who don't who don't have access to these puberty blockers at the appropriate time, those are the ones who are at higher risk for suicide. All of the data that we have says once you take them off the puberty blocker, the body begins, if everything else stays the same, the body begins to initiate puberty. I think it's the pituitary gland that kicks in and begins to change the body in ways that manifest for the biological sex. In terms of surgery.
Can I respond to that?
Sure.
The puberty blocker, thank you.
Okay.
So we must be reading different medical information. I have a stack of it right here in front of me. I've done my homework. I think you know I do my homework. And I will tell you that is not what the medical research shows. I can read you a list of things that puberty blockers do. They risk infertility by blocking the maturation of sperm and eggs. Puberty blockers compromise bone mineral density. I've seen this in many, many studies about bone density by giving puberty blockers to adolescents. They hinder brain development and compromise sexual function. The U.S. FDA added a warning for a pseudotumor cerebri, which Dr. Hill could probably pronounce better than me, July of 2022. So less than a year ago, there is a study that is showing serious health effects. They are not proven fully reversible, and long-term complications are known. After cross-sex hormones, estrogen used in male biology strongly increases the risk of blood clots and heart attacks, strokes, breast cancer, insulin resistance, and more. I have a whole list of things, and this is from a medical study. I'm not making it up. I didn't get it on People magazine. I mean, these are real science data. So I hope that, you know, I understand that you're presenting the facts as you know it, but I've talked to numerous doctors, and that is not what the science is showing. That in Britain, they closed their clinic. Did you read that? Did you know that? Great Britain had a clinic where they were doing a lot of these treatments, and they closed it because of the health risk to kids.
All right, let me allow her to address that, okay?
Thank you.
Delegate Collison.
So virtually every medical profession in our country supports the use of puberty blockers. I don't believe that our practitioners, as a group, as organized groups, would be advocating for medication that would be harmful. As I said, I think there may be instances with individuals who have reactions to medication, but in general, they've been used for 50 years. If we had seen the kinds of repercussions that your studies are addressing, and I'd like to see them, then I can't imagine that we would continue to use them in this country.
Well, it is from the American College of Pediatricians. So what I just read you is from a national, reputable, recognized organization of pediatricians. So, you know, you can't say all the medical data says, because that's not true.
No, what I'm saying that is most of the medical organizations of practitioners
Well,
are.
some, maybe
Right.
not most.
Okay.
But.
I wanted to address the age restriction issue that Delegate Hutchinson raised. Most of the commercial insurance companies require the person to be 18. The only time for surgery, any kind of, you know, surgery, the only time there's an exception to that is when there is a clear and present danger to the young person because of their dysphoria. In what I've heard from some of the physicians is that happens after a suicide attempt. But again, I'm going to say no surgery would happen in less than a year's time. The requirement is there's intense psychological support, there's parent support, there's the young person who is in distress and asking for this, and they have to live for a year in the gender that they see themselves as, that they understand themselves to be, before surgery will be considered. So the occurrences of surgery under the age of 18, the statistics are, it's, you know, like way less than 1%, way less than 0.1%, because it's a few individuals who are experiencing such distress that the only way to make sure that that young person stays alive is to allow them to become the person that they know they are. In terms, and Delegate Morgan, you made that comment that gender dysphoria is a mental illness. And indeed, that's what, you know, it is defined as. However, the thing that's causing the mental illness is the fact that their understanding, their knowledge of who they are does not match their biological sex. And it is, you know, it's almost incomprehensible to us who haven't experienced it, but we know, all of us know people now who have been down this path, and can explain that, that dysphoria can be addressed with the appropriate treatments. And, I need to say too, not every person with gender dysphoria decides to go through every single treatment. They make their own personal decisions about what's best for them. And what we're trying to do is say, we want to make sure that those who are financially not struggling or challenged are not relegated to not being able to become who they know they are, and who experience self-loathing, who experience incredible harassment, abuse, and frankly, more transgender people are murdered proportionally in this country than other groups of other classes of people, because of they do not they're not socialized, because they're not living the life that they know they are. And I have one other comment, and then I'll stop talking. And Delegate Morgan, you mentioned what's happening. Why is this expanding? Why are there so many more now in each succeeding generation? And I truly believe that it has to do with greater acceptance, and not just greater acceptance, but the desire to self-actualize. People are getting their voices and are saying, I need to be seen for whom I am. And that is throughout our culture, and virtually every kind of different person is gaining that voice. So, again, I have to go back to, I wouldn't choose to be someone who would be subject to abuse and discrimination. So these folks are not choosing this. This is who they are, and we can help them. We can help them stay alive by making sure that the medical care they need to self-actualize is available to them. So with that, Madam Chair, I'll stop for now.
One second, may I just continue with Delegate Shalega and then come back, please? Thank you so much. Delegate Shalega.
Thank you. So back to the youth, and, we've had quite a bit of discussion about when youth's brains mature, and, a bill to not charge people under 25 with a crime, and, so many of us are very concerned about the youths, and hence my questions about puberty blockers. And in the bill, I see that the standard of care that this bill, and which means the law going forward, is going to be WPATH. And under WPATH, their ages that they had reported for treatments: 14 for cross-sex hormones, 15 for removal of breasts, 17 for removal of testicles. And I think that castrating children is wrong. And if we adopt this bill under these standards of WPATH, we are opening the door to castrating and mutilating the bodies of children. And yes, I'm heartbroken for their mental health. I am. And the other data that I have here shows what Delegate Morgan said. It's a well-known study. 85% of the children that are having gender dysphoria, gender questioning, 85% of them return to the gender they were born with. And they do not commit suicide. And if they get the right mental health treatment, that's what we should do. All of us are for that. But allowing, especially stories in divorced couples where one parent is allowing their child to be disfigured and the other parent isn't. That these are well-known court cases that you can find. And I think it's very irresponsible of us to not put an age limit on this and say no one under 18 can alter the genitals and gonads. That they should not be getting their breasts removed, their testicles removed. It's a step too far. And not recognizing that these other treatments have very, very serious lifelong complications is irresponsible as well. You know, the Tavistock Gender Identity Clinic for Children in Great Britain, it's been closed because they found that these treatments are not effective and they're not safe. And they have people that are detransitioning now, that are suing doctors and hospitals for doing this to them. So this is a step too far. You know, I hope that you would take an amendment to limit any of these treatments to 18 or older.
Okay. Delegate Collison, do you want to say anything else, or may I go to the next person? All right, so let me go, Delegate Morgan, and give someone that has not had a bite yet, just to be fair. Okay, I appreciate it, and thank you, everyone, for your patience, okay? The way I saw it, I see Delegate Rosenberg, followed by Riley, followed by Taveras, followed by Hutchinson, followed by Hill, followed by Kipke, followed by Kaiser. Okay? So let's go with Rosenberg.
Thank you, Madam Chair. I have a question for the sponsor, for Delegate Cullison. In light of the conversations we've had, under this bill, how would the relationship between a patient who is a minor and a healthcare provider differ from that relationship as provided for in Maryland law for other sensitive areas of healthcare where the patient is a minor?
I think that it is the same. I mean, we have the same requirements for any kind of major medical support would apply here. Now, one of the things that we have in this particular bill is, and in the work that we do towards working to resolve the issues for folks with gender dysphoria, is it's a team approach. So it is the person themselves, it is the parent if it's a young person, and it would include mental health specialists as well as the appropriate other physicians who would be involved. So it's pretty intensive, I would say, in terms of this is not an easy process, and it includes a team of people. No decisions are being made without that kind of team collaboration.
And if I may, and that is comparable to the care that must be provided in other, for want of another term,
Right.
sensitive areas of healthcare where a minor is involved.
Correct.
Thank you.
Okay, next, we have Delegate Riley, followed by Taveras.
Thank you, Madam
My
Chair.
pleasure.
Yes, so I guess my research is similar to what Delegate Shalega had experienced, and when I was looking through that, the most difficult was her last point was actually, finding out that altering the body parts of a minor was very disturbing. So I went a step further and not only went through the research, but then also seen several YouTubes of actual minors that I'm assuming with the consent of the parents, what have you, had these surgeries. And then years later, as they're now adult, I mean, to hear their stories, it was devastating. And to talk about, what they went through at the time, and then now they wish they would have never had the surgery. And they wish also at the time when they were going through that, mental distress, that they were giving different help than pointing them towards the surgery to basically mutilate their body, and then coming to the point as an adult and wanting to go back and it being very difficult and very damaging. So again, I saw one too many of those, and it was very, very distressed and disturbing. So I do think, you know, as Delegate Shalega mentioned and others, you know, to put the age, you know, once they're an adult, if they want to do that, you know, they're done certain things. Now they're the choice of their own body at that point. They're of age to where they can really make those types of decisions. There's so many laws that we have on the books now that we say, you know, the child cannot make those type of decisions, but yet we're going to let them make the decision to mutilate, you know, their bodies, basically, and then regret it years later. So, you know, I do wish that you would, you know, put the amendment on there to at least make it, you know, 18 and above for them to be able to do this. So, but thank you.
Okay. Delegate Taveras.
Thank you. I just had a question with regards to how long. I mean, it makes it seem like folks are just waking up one day and saying, "Oh, I want to cut off X, Y, and Z." Is this process not? Does this process not take a very long time for you to get to that situation?
Go ahead.
Thank you. Thank you, Madam Chair. Yes, it takes a very long time. This does not happen even in a year. This happens over the course of years. And what you learn is, you know, young people recognize earlier than we would expect that they are very different and that there is something not right about them. And it begins to manifest in different ways. And then with the support of the adults in their lives, we hope that they're getting the mental health support that they need to begin to address it and identify it. But again, you're right, Delegate, it happens over the lifetime of the person, basically, until they self-actualize.
Next, I have Delegate Hutchinson, followed by Hill.
Thank you, Madam Chair. More of a point of clarification for the Vice Chair. I think you said that Medicaid is currently covering some forms of gender-affirming care. Did I hear that correctly?
Delegate Vice Chair.
They are covering the puberty blockers and the hormone therapy that you would get after the age of puberty.
Okay, so the reason I asked that, in our subcommittee meeting, Tricia Roddy was on, and I did ask her that question, and she came back and said, no, Medicaid doesn't cover gender-affirming care. I do believe that some of the hormones that are used are available under Medicaid for other issues where they would be applicable, but it wasn't specific towards gender-affirming care. At least that's my recollection of that, and I know there's been a lot of dialogue back and forth, so I may be confused too.
I was confused. I watched the subcommittee meeting, but after some further research, we discovered that they are indeed supporting that, the puberty blockers and the hormones.
Okay, so I didn't misunderstand Tricia Roddy when she answered my question. You're
Right.
saying since then you discovered that
Right.
there is. Thank you.
My pleasure. I have Delegate Hill, followed by Kipke.
Thank you, Madam Chair. I appreciate the discussion. I'm going to start off just by saying that while I'm not surprised and I understand, I am still a bit disappointed that I guess what I see is essentially a health equity bill has been, I'm not disappointed in the kinds of questions, so let me not imply that, because I'm not trying to question the sincerity of anyone and the importance of all of us being comfortable with the votes that we take. But the fact of the matter is that people of means are given the agency to meet with their healthcare providers, discuss the particulars of their situation, undergoing whatever appropriate tests are needed, given options, given risk, limitations, potential complications, allowed to take the time to think and consider, get second opinions, and make decisions about themselves and their children without the government making a decision about whether they can go forward or not. A government that's not even in the room to hear the discussion. And yet, with this bill, our discussion has come down to whether people who don't have the financial resources and therefore are dependent on medical assistance that the state, through pass-through dollars and other things, actually administers, should be able, or actually paternalistically or even mature enough to consider all of those factors and make decisions to not have treatment, to have treatment, to allow treatment for themselves and for their children. So that's the part that's disappointing to me. I would also say, and what I want to share with the group, is something we all know, which is that science is always evolving, right? And part of the responsibility of being in the healthcare profession is to not get stuck in how we were trained, but to look at the evolving information, the changing science, to be open to seeing things differently, to not do things that we once did that were found to be incorrect, and to do things differently when we can find better ways to do them. So with that being said, that's why the informed consent and the discussions that nobody can be in except for the people who are involved are so important. When we talk about what is considered medically indicated or medically appropriate care, there is some misunderstanding that those are generally hard and fast lines, when in reality, they are most often a function of not what a procedure is or what a treatment is, but what the reason for the procedure and the treatment is. So if I have a 5-year-old who is experiencing precocious puberty, right, starting to get breast, starting to menstruate, it is really appropriate to give them puberty blockers if their parents think so. If I have someone who has certain kinds of idiopathic short stature, it may be worth the risk to them in their parents' mind, because it's not the children who are making these decisions. It may be in their parents' mind and in the doctor's mind appropriate to put them on puberty blockers for a while to allow them to reach closer to normal stature, since starting puberty pretty much stops growth, okay? So there are lots of reasons that a particular medication, including gender dysphoria. I can do a nose job for one person and it's completely medically indicated, and do it for somebody else and it's completely elective and cosmetic. And I've certainly had patients who've said to me, can't you just tell my insurance company that I need to have it? And I don't know what other folks do, but I know because of the integrity I try to take in what I do, what I say to them, but then I'd be lying to the insurance company. And if I lie to them, then won't I lie to you? And do you really want a surgeon who'd lie to you as their patient? So no, I'm not going to misrepresent the reason for your surgery. And so, you know, that just follows for all the things we're talking about. The indications are what really determine, and all this bill says is that if it is in the professional opinion of the people who are treating the patient, that the treatment that is recommended is medically appropriate, that the insurance company should respect those professional decisions, particularly as we've discussed with other bills, since the insurance company is not in the room, and respect it and cover those services. And it's really that basic to me. It's about economic equity. It's about agency over one's healthcare decisions and the ability to make decisions for your children that you think are in their best interests. And I just wanted to, because there's so much discussion about the medicine, and again, we keep getting caught up in the social aspects of, you know, whose job it is to make decisions about whether this is going to cause long-term damage. And I'll even say that, I don't know of any procedures where there's not somebody who regrets it later. There's just not that. I could agree to have my appendix out and be sorry about that down the road because of the complications that may have occurred. But there's a difference when I, as a parent or as a patient, get to make that decision, meaning that I have to live with the repercussions, than when I don't even get that choice. And I don't doubt that there are people who've agreed. I've had patients in my office who are adolescents, and I've had to make decisions about whether I was going to perform surgery, whether it was appropriate at their age, whether they understood, whether their parents understood. And there have been patients that I've said to them and their parents, come back in a couple of years and then we'll talk about it again. And there have been patients where I've said, no, I think this is exactly the right thing to do. And most of the time, it's proven correct. Once or twice, I've had to take that chin implant because they really weren't as mature as they thought they were going to be. So that's what you do. And that's part of being in the profession, is to make your best recommendations based on the people who you're caring for, and then allow them to make their best decisions. And all this bill says is that your insurance should cover that, regardless of whether it's Medicaid or private. And it should do it because the private insurances already do. And that's all I want to say.
Thank you. I have Delegate Kipke.
Thank you, Madam Chairman. I have other reasons for opposing the bill. You may be aware that in Medicaid, we have lots of waivers for medically fragile people. The Maryland Community Pathways Waiver, the Maryland Community Supports Waiver, Maryland Family Supports Waiver, Maryland Home and Community-Based Options Waiver, Maryland Medical Daycare Waiver, Maryland Waiver for Fragile Children, Maryland New Directions Independent Plus Waiver, Children with Autism Spectrum Disorder. All of those have enormous wait lists because we don't have enough money to take care of those people. We have bills before this committee to deal with the autism waiver, personal care aides, and the Wait List Now Act, employed individuals with disabilities, dental service, and we can't afford to fix any of that. And I mean no disrespect when I say this. I think people with rotting gums that are 9 years old should be put at the top of the list. And we have to make choices and prioritize what we can afford to do in Medicaid. So that's my reason for opposing it, is that fewer of those people that I just called out are going to get care because we're spending money over here on this. And I think the priority needs to be with some of these other more medically fragile individuals. But my question is this, and I could be totally wrong about this, but I don't think that I am. March 10th, 2016, Maryland Medicaid Assistance Program put out a bulletin to all the MCOs in Maryland that gender-affirming care is now a required coverage for adults. It's not just puberty blockers or hormone therapy treatments, but it's also gender reassignment surgery. This is already the law in Maryland. This is already being covered in Maryland, and that hasn't come up one time during this discussion on this bill. The change that this bill makes is it expands this to people under 18 because the current regulations in COMAR requires that the individual be at least 18 years of age, the individual has full capacity to make informed decisions and consent for treatment, and the individual has been diagnosed with gender dysphoria and exhibits a series of things. The bill before us is already the law for adults. This bill does one major thing. It removes the age requirement of 18 and older. Isn't that so?
Delegate Collison.
So it's my understanding that those are the federal regulations that our state of Maryland have not complied with. And so all of those requirements that you just identified, which were in place in 2016, our Maryland Medical Assistance Program has not been providing. In terms of expansion, I'm suggesting, and knowing it in addition to my response to Delegate Hutchinson, the puberty blockers and hormones are being covered by Medicaid. So we're not expanding anything. And as I said before, the surgery is only available or used under extreme conditions. And in the country, there's probably less than 20 people under the age of 17 who have had surgery because they want to, as we said, commercial insurance generally requires the person to be 18. But we want to make sure that those who absolutely need it can get it. So we just want to make sure that Maryland's law is aligned with and conformed with the federal regulations.
Quick follow-up, if I may.
Absolutely.
So this is all in COMAR already. I'm pointing out something to you that I believe to be true, and I'll print off what I have for you to, because you may get this question.
Okay.
This is all in COMAR right now. So you're codifying COMAR, but removing the age cap.
There's, in COMAR, is there an age cap?
18.
For what services?
Well, this particular bulletin refers to outpatient psychotherapy, mental health services for gender dysphoria, continuous hormone replacement therapy, outpatient laboratory testing to monitor continuous hormone therapy, and gender reassignment surgery. For individuals planning to go under gender reassignment surgery, you must be 18. So I'll print this off. This is COMAR.
But I would go back to, Madam Chair, I'm sorry.
Absolutely.
I'd go back to the fact that there are instances, there are exceptions, there are cases where we are going to save a life. When we have a team of people, including the person, including all of the medical professionals involved in the life of that person, and the adults who are responsible for that person are together saying, if we want to save the life of this person, we need to make sure they have it now, even if they're just 17. And we want that to be available to them.
Thank you, Delegate Kipke, for the question and for giving Delegate Collison that material.
Yes.
Appreciate it. Next, I have Delegate Bagnell.
Thank you, Madam Chair. And I really wasn't going to speak on this bill because I did speak a lot during subcommittee and I listened a lot during subcommittee. But I just want to sort of reiterate what Delegate Hill brought up, in that we hear a lot of scope of practice bills in this committee, but this is not a scope of practice bill. It's a Medicaid reimbursement bill. So we aren't changing the medically necessary standard of care, just who can receive it. And we are expanding services because, to the point that was made, there are services in Comar, but they don't necessarily address the alterations to the voice therapy, voice lessons, alterations to the face and neck, laser treatment for scars from gender-affirming treatment. The secondary services which fully realize, that fully actualize your gender identity. So I really just wanted to make that point, and also make the point once again how much I appreciate the respectful dialogue. And I hope, to Delegate Morgan's point, that you didn't feel in the subcommittee that we were that I was making people feel uncomfortable with asking questions and challenging, because we do understand this is tough if you don't understand it. If it's not a lived experience. And we know that sometimes the dialogue is tough for people to hear, people who are experiencing gender dysphoria. So I just hope that that our committee and our subcommittee understand how much we appreciate the respectful dialogue and the fact that you're asking the questions that we need to be able to answer. So thank you.
Delegate Morgan.
Chair.
My pleasure.
So first, when I opened up, I made a statement about having a respectful dialogue and everyone's opinion. That was more of a comment for people out here watching and on the internet and stuff like that. Everybody here on the committee, I mean, look, it takes a lot to offend me. And everyone here always treats each other with a lot of respect. And we can have good, vigorous debate. And believe me, you're not going to hurt my feelings.
We're still gonna go and have what do I like? I like cheesecake, a slice of cheesecake.
So if you have anything, that was not obviously directed to anybody on the committee. But back on the bill, we've this hearing's been good because we figured out a lot about this bill, and it is about children. And this is what our concern has always been about. And I personally don't describe to the equity argument in this bill, because I understand what you're saying, that this is being done in private insurance and people with means are having it done. But if I could ban that right now, if we had an amendment right now that limited us to 18 years old and basically just codify what's already in Comar, yeah, I would vote to limit this bill. If we wanted to ban what is going on in the state and limit this to in private insurance, I would join the other 6 states in this country that in the last year have banned this for kids under 18. Because I think there's something going on in society where people are being driven this. And I will tell you that we keep hearing this argument all the time about, well, we need to save the one life, high rates of suicide. And that's unfortunate because there is a high rate of suicide in the transgender community. That's why we probably shouldn't be pushing kids towards it. But I go back and look towards different studies out here, like I'm looking at one right now. Swedish study says 10 years after sex reassignment surgery, transgender patients were 19 times more likely to die from suicide. So we keep saying that this is a solution. I'm not sure it is. And I took the liberty to emailing every one of you an article that was printed, came out on February 9th of 2023, just a few weeks ago. And it talks about a transgender woman. The article starts off, I'm 42 years old, St. Louis native, a queer woman, and politically to the left of Bernie Sanders. That's how the article starts off. And she worked at the Washington University's Transgender Center at St. Louis Children's Hospital. And basically, she worked at this hospital and she thought she was saving trans kids' life, and now she's a whistleblower because she's worked there 4 years and she sees what these medical treatments have done to children. And look, I just don't think it's right. So look, if you would do just a courtesy of maybe checking out that article, because I know with media nowadays, it is pretty unbelievable what some of us see and what some of us don't see. I think it would be a good education to see where our points of view are coming from. Thank you.
Thank you. Delegate Shalega.
Thank you. For one more bite at the apple, I was going to say a couple things Delegate Morgan said, and Delegate Cullison, you said we're going to save a life, and we feel the same way. So we are going to save the life of a child who is going to be mutilated by this bill. And we are as passionate about that as you are. And we believe this is so wrong for children. And Delegate Hill said the science is evolving, and she's right. The science is evolving. Here's an article that's less than 6 months old. Over the past 2 years, Finland, Sweden, and the UK have conducted systemic reviews of evidence for the use of puberty blockers and cross-sex hormones in treating pediatric gender dysphoria. Health authorities in all 3 countries reached the same conclusion. The belief that mental health benefits of these interventions outweigh the cost is based on very low quality evidence. They are saying they are not doing it. These 3 countries that have been deeply involved in these treatments are stopping doing this because they want to save a life. They want to save a life of a child who needs more mental health services, who needs acceptance, who needs their parents involved in this. We just had a debate on the floor, and we said we're not going to tell the parents. We're not going to tell the parents if a child is suffering at school and feeling like they're being bullied because of a gender issue. But we know, you just said, we need parents involved in this. So we can't have it every way here. We need parents involved, and we need to wait until children are at least 18 to make life-changing decisions that will mutilate their bodies and remove their sex organs and remove the opportunity for them to have a biological family. This is serious, serious stuff. Very serious stuff. And we believe, just like you, Delegate Cullison, that we are saving a life. Thank you.
Okay. Does anyone else want to be heard, ask a question, make a statement, express their feelings, their views? I'm going to look at the left, and then I'm going to look to the right, okay? And then we will move on. Let me look to the left, please. Thank you. All right, I don't see anyone to the left. I'm going to look to the right. Delegate Hutchinson.
Thank you, Madam Chair.
My pleasure.
Probably more of a sort of a technical question, since we have determined that puberty blockers is currently covered under Medicaid. And why is it listed in this bill as a new service that would be provided under Medicaid?
Right. Delegate Collison, thank you for the question.
Yes, thank you. It's codifying. It's just making sure that we have the full range of services that could be a part of the transition period, and the treatment period is all in the statute. It's all codifying.
Thank you. Any other questions? Okay, Delegate Kaiser.
Thank you, Madam Chair. Appreciate you giving me the last word before you. I wanted to say 2 things. After you read Delegate Morgan's article, please also hope you read the 2 articles I shared that debunk that article. So please read all the material. I also heard a reference earlier to the American College of Pediatricians, and I would just like to take the opportunity to point out the medical groups in favor of this treatment. The American Medical Association, the American Academy of Family Physicians, the American Nurses Association, the American Academy of Pediatrics, the established pediatric group for the country, the American Society of Plastic Surgeons, the National I'll skip that one, not doctors, American Psychiatric Association, American College of Obstetricians and Gynecologists, National Association of Nurse Practitioners in Women's Health, the American Psychological Association, the Endocrine Society, the American Academy of Child and Adolescent Psychiatry, the American Public Health Association, the American Academy of Nursing, the American College of Physicians, the American Academy of Physician Assistants, the Pediatric Endocrine Society, the American Academy of Dermatology, the American College of Nurse Midwives, the Society for Adolescent Health and Medicine, the American College Health Association, the American Counseling Association, the World Professional Association for Transgender Health, the American Heart Association, the American Medical Student Association, the World Medical Association, the American Osteopathic Association, and the World Health Organization. I stand with them. Thank you, Madam Chair.
So I think that, is there anyone here that wanted to speak that didn't get to speak on this issue? So I want to thank everyone for having a respectful, thoughtful conversation. I think that as I sat here and I listened, I thought that what is really great about the world is how it looks so different from every point of view. And how there's a quote that says that nothing is beautiful from every point of view. But being able to understand a person is important. So Delegate Shalega, I understand what you said. And I respect your view. And I know that you believe it. And I respect it. I really do. And we all come here with different backgrounds and perspectives and life experiences. And they shape us, what we believe and how we believe, right? And how we vote. And there's nothing wrong with that. And it's not personal at all, like you said. It isn't. Those are our feelings, regardless of where you are in life or how you feel. And they need to be respected, you know, because they're important. So I thank you all for expressing your views and for giving feedback. And I want to thank staff for all you do, all the amendments, all the hard work, all the phone calls, all the meetings. I really appreciate it. And thank you so much for moving this along, okay? So on this bill, we were discussing the amendments. So the amendments have been moved in second. Let's just do it again just to make sure. Move the amendment. Second, we had the discussion. All those in favor of the amendments say aye. Aye. Any opposition to the amendments? Seeing none, on the bill as amended, may I have a motion? It's been moved in second. Any discussion on the bill as amended? Seeing none, all those in favor say aye. Aye. Any opposition, can you raise your hand? I have Delegate Shalega, Delegate Chisholm, Delegate Morgan, Delegate Riley, Delegate Hutchinson, Delegate Kipke. Thank you, everyone. Does anyone not want to be on the bill? Can you raise your hand? I have Delegate Shalega, Delegate Chisholm, Delegate Morgan, Delegate Woods, Delegate Olston, Delegate Bandari, Delegate Riley, Delegate Hutchinson, Delegate Kerr, Delegate Johnson, Delegate Kipke. Should I do it again? Oh, you have it? You have it? Okay. Thank you so much, everyone, for the discussion. Really appreciate it. All right, let's go on to the next page of bills. We have House Bill 290, that's Delegate Bagnall, It is titled Public Health Dental Services Access. It is Aaron and Bagno. Aaron.
House Bill 290 alters the Maryland Dent Care Program to include dental hygienists. It requires MDH to create and distribute specified plain language materials related to dental services, requires the State Board of Dental Examiners to publish a searchable list of mobile portable dental service providers, requires MDH to convene a stakeholder work group to study the establishment of a specified grant or loan program for dental providers, and requires MDH to conduct a study on dental provider participation in the Maryland Healthy Smiles Dental Program. There are amendments in your packet that were adopted in the Public Health and Minority Health Disparities Subcommittee that require the Maryland Public School System, certain family care child homes and child care centers to provide notice to the parent or guardian of an enrolled child of the clinical need for the child to receive a dental screening within 6 months before the child's 6th, 9th, and 12th birthday, and that notice is to be provided 6 months before the birthday. The amendments strike language in the bill that would have prohibited the Secretary of Health from conditioning or limiting eligibility for medical services based on an individual's citizenship or immigration status. The amendments strike the mandatory Medicaid rate increase for dental services, require MDH to study providing reimbursement for services provided to a Medicaid recipient by a community health work and by a recipient by a community health worker.
And if I may just take a break, Delegate Tavera is a yes on House Bill. Yes. And at her, and she wants to be added as a co-sponsor. Okay, so, that was, who was that? That was Delegate Bagno? Delegate Bagno.
Thank you, Madam Chair. The amendments were consensus amendments that significantly brought down the fiscal net impact and also got all of the stakeholders on board, addressed some of the concerns that were raised during the hearing, and remove the mandate. With that, I would move the amendments. Oh, and the vote was unanimous. Move the amendments.
Okay, so it's been moved in second. Any discussion on House Bill 290? Seeing none. Oh, yes, Delegate Shalega.
So this is just notification, right?
Yeah, that's correct. There's no mandatory screenings.
Thank you.
Okay. Any other questions? Any concerns? All those in favor of the amendment say aye. Aye. Any opposition? And the bill is amended. It's been moved in second. Any discussion from anyone? Any concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Does anyone not want to be on the bill? Can you raise your hand? Delegate Shalega. Okay. Thank you. We're moving on to House Bill 456, Pharmacies, Prescription Drugs, Accessible Labels for Blind, Visually Impaired, and Print Disabled Individuals. It was passed favorable with amendment. It is Lindsay and Rosenberg.
As introduced, this bill required each pharmacy to notify customers that an accessible label for blind, visually impaired, or otherwise print-disabled individuals is available on request for no additional cost. On request, a pharmacist must explain to the customer the available accessible label format options and provide the customer with their choice of accessible label. The amendments that begin on page 28 of your packet strike the bill and instead requires the State Board of Pharmacy to adopt regulations necessary to ensure that individuals who are blind, visually impaired, or otherwise print disabled have appropriate access to prescription labels, bag tags, and medical guides at no extra cost to the individual in a format option through which the information is fully accessible to the individual and within a time frame comparable to the time frame within which the information is provided to an individual who is not visually impaired, requires the board to give visually impaired individuals an opportunity to provide input on the regulations, requires the regulations to follow certain guidelines and recommendations issued by the U.S. Government Accountability Office and include a method for providing notice to customers, requires the regulations to be adopted by January 1st, 2025, and also specifies that on or before December 1st, 2023, MDH must submit a report on the potential process for and costs of implementing enhanced professional dispensing fees for providing accessible labels and compliant packaging to blind, visually impaired, or otherwise print-disabled individuals.
Delegate Rosenberg.
Thank you, Madam Chair. These amendments, as described by council, were supported by all the relevant parties, the affected parties, and do provide for time for this to be implemented. And it was a unanimous vote in the committee on the amended bill.
It's been moved in second. Any concerns, questions, discussion on the amendments? Seeing none on the amendment, all those in favor say aye. Aye. Any opposition? Seeing none on the bill as amended? It's been moved in second. Any discussion or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Who does not want to be on the bill? Can you raise your hand, please? Everyone wants to be on it. Thank you. House Bill 477, Public Senior Higher Education Institution Reproductive Health Services Plans Requirement is Aaron. Last time we were here, we're secondary. Appropriations is primary. Last time we were here, I actually held it. Delegate Shalega requested a hold and I granted it. And so we're here now. Delegate Shalega.
Thank you, Aaron, so much for working with me on an amendment, but I'm not going to hold the bill. I'm not going to offer the amendment.
Okay. Thank you. Delegate Morgan.
Thank you, Madam Chair. Didn't the Senate already move this bill? Can somebody just remind me of the vote count?
Hold on 1 second, please. Aaron is checking it. 1 second. 1 minute. See who can find it faster. You get a little bit of my cheesecake, just a piece. They did? What was the vote? All right. Okay, my pleasure. 31-13. Thank you. Any other questions or concerns? Okay. So.
Madam Chair, there are amendments.
There are amendments, okay. Can someone move, and you described it? Can you describe it? Okay.
There are amendments, so the bill would require each public senior higher education institution, in consultation with students, to develop and implement a reproductive health service plan to provide at the institution or to refer students to a comprehensive range of reproductive health services. There were amendments that were adopted in the Appropriations Committee that alter the definition of public senior higher education institution to exclude certain institutions that do not have residential campuses, and strikes the requirement that the plan include access to transportation to support students in accessing off-campus services.
Okay, so those are the amendments, and can someone move, Delegate? It's been moved in second. Any discussion on the amendments that Aaron just described? Seeing none, any concerns? Okay, no, wait a minute. All those in favor of the amendments say aye. Any opposition? On the bill now, Delegate Bandari. It's been moved in second. Any discussion on the bill as amended? See, Delegate Taveras.
Why is there, why was the access to transportation and other wraparound services to support students for them to use campus reproductive health services taken out?
According to appropriations staff, they were concerned with liability issues with providing transportation. And there's also, if you look in the fiscal note, some of the campuses on the Eastern Shore that might be long distance to get to those services.
Okay. All right. Any other questions or concerns? All those in favor of the bill say aye. Aye. Any opposition to the bill? I have Delegate Shalega, Delegate Chisholm, Delegate Morgan, Delegate Riley, Delegate Hutchinson, and Delegate Kipke. And on this bill, there's no sponsorship because it's not our bill. We're not primary, okay? All right. Maybe 20 years from now, they'll add another layer. So we are going to, 1 second, House Bill 596, Health and Human Services Transportation Improvement Act of 2023. That is Aaron and Delegate Kerr. Aaron.
The bill establishes a state coordinating committee for health and human services transportation in the Maryland Department of Transportation and repeals the limits on annual funding for the Maryland Senior Rides Program and the Job Access and Reverse Commute Program that is administered by the Maryland Transit Administration. There is a reprint of the bill in your packet that incorporates amendments that were adopted in government operations and health facilities that strike the establishment of the rural non-emergency medical transportation program and the associated mandatory funding.
Delegate Kerr.
Thank you, Madam Chair. It also removed $1 million mandatory appropriation, but it kept the lifting the caps and establishing a coordinating commission. After some discussion in subcommittee, it passed unanimously. The bill came from the Rural Maryland Council. Rural Maryland Council was in the subcommittee meeting and was good with the amendments, so I move the amendments.
It's been moved in second. Any discussions? Any concerns? Seeing none, all those in favor of the amendment say aye. Any opposition? Seeing none, and the bill is amended? It's been moved in second. Any discussion? Seeing none, all those in favor say aye. Any opposition? Does anyone not want to be on this bill? Raise your hand, please. Delegate Shalega, Delegate Morgan, Delegate Chisholm, Delegate Riley, Delegate Hutchinson, Delegate Kipke. Thank you. House Bill 690, Maryland African American Museum Corporation Board of Directors membership. This is Lindsay and Delegate Kerr.
This bill alters the membership of the Board of Directors of the Maryland African American Museum Corporation by reducing the number of members. Instead of the chairman or designee of the Commission on African American History and Culture serving as a member of the board, the Commission must approve one member to provide continuing coordination and cooperation between the corporation and the Commission. There's an amendment on page 44 of your packet that adds to the corporation one member of the Senate and one member of the House.
Delegate Kerr.
We received a letter of support from the Baltimore City delegation. It passed the Senate 45-0. There were no concerns in subcommittee. It passed unanimously.
It's been moved in second. Any concerns, any questions about the amendments? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none on the bill, is there a motion? It's moved in second. Any concerns, any questions? Seeing none, all those in favor say aye. Aye. Any opposition? Who does not want to be on the bill? Can you raise your hand? Everyone wants to be on it. And you know, I was thinking that, Lisa, you only have 2 bills. May we do Lisa so she can get going? Okay? So let's do Lisa. Let's go to, and I apologize, I should have thought about that a while ago. Forgive me. Let's do House Bill 977. House Bill 977, Maryland Department of Health, Office of the Chief Medical Examiner, that's Lisa and Bagnall, favorable with amendment. Lisa.
This bill establishes the Office of the Chief Medical Examiner as a unit within the Maryland Department of Health to advance forensic science through medical education and research as staffing allows and carry out any other duty established in law. The bill redesignates the State Postmortem Examiners Commission to be the Postmortem Examiners Advisory Committee, which must advise the Secretary of Health and OCME on the implementation of the Postmortem Examiners Commission subtitle and OCME's duties. There are amendments on page 68 of your packet. The amendments change the sponsor and make other technical changes.
Delegate Bagnall.
Thank you, Madam Chair. This was a unanimous vote, non-controversial. I move the amendments.
Second.
It's been moved in second. Any questions or concerns regarding this bill? Delegate Hill.
What does the bill do? I'm just messing with you. I know you're trying to get me.
Okay. Not a problem. Not a problem. Okay. All those in favor of the amendment say aye. Aye. Any opposition to the amendment? Seeing none of the bill as amended, is there a motion? It's been moved in second. Any questions or concerns about the bill as amended? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, who doesn't want to be on the bill? Can you raise your hand? Everyone wants to be on the bill. Lisa, we also have, which is the other one? 1151. Let's do that.
This bill.
Excuse me? Can you leave early? No, no. Sorry. That's what you get, the perks of being a legislator. Go ahead.
This bill requires Medicaid and the Maryland Children's Health Program, as
Nice
well
try.
as health insurance carriers, to provide coverage for all services rendered by a licensed pharmacist acting within the pharmacist's scope of practice to the same extent as services rendered by any other licensed healthcare provider. Pharmacist reimbursement may not be conditioned on whether the licensed pharmacist is employed by a physician, pharmacy, or facility, or acting under a physician's orders. There are amendments on page 75 of your packet that modify an insurance-related provision in the bill to reflect that the intent is to require reimbursement of pharmacists for services that are covered under the policy or contract, and not to create a new mandate for services, and delays the implementation date to January 1st, 2024.
Delegate Collison.
Yeah, thank you, Madam Chair. This bill was worked on over the interim, and all the parties came together and was all ready to go when Delegate Bandari brought it to us, so I would move the amendments.
It's been moved in second. Any questions or concerns? Seeing none, all those in favor say aye.
Aye.
Any opposition? Seeing none, on the bill is amended.
Move the bill as amended?
It's been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? None. Who doesn't want to be on the bill? Can you raise your hand, please? Everyone wants to be on it. Lisa, have a great evening. All right, let's go back. Let's go to... Let's go to House Bill 717, State Board of Nursing Peer Advisory Committee Scope of Practice and Licensure Requirements. This is Lindsay and Rosenberg. Lindsay, can you please explain the amendments?
The bill
Oh, the bill.
first authorizes a licensed certified midwife to delegate a technical task to an assistant, authorizes a licensed certified nurse midwife or a licensed certified midwife to personally prepare and dispense a starter dosage of a drug, eliminates the requirement that an applicant for a certified midwife license complete coursework in health and sciences, alters the definition of practice certified midwifery, practice nurse midwifery, certified medication technician, and certified nursing assistant, adds an exception to the licensure requirement to practice certified midwifery, authorizes the Maryland Board of Nursing to appoint peer advisory committees to provide advice related to midwifery, requires the board to develop regulations governing the delegation of technical tasks by licensed certified midwives to assistants, and requires the Maryland Department of Health to submit a report on recommendations to expand access to birthing services in birthing centers in the state. There are amendments that begin on page 45 of your packet that make technical changes, clarify the definition of certified medication technician regarding the tasks performed by a CMT, and the definition of certified nursing assistant to clarify that practice is subject to regulations adopted by the Board of Nursing, and clarifies the education requirement for an individual to be exempt from requirements to be licensed as a certified midwife.
Rosenberg.
With these amendments, it was unanimous among the relevant parties and among the members of the subcommittee. So I would move the amendments.
It's moved in second. Any questions or concerns regarding the amendments? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, on the bill as amended? Second. It's been moved in second. Any questions or concerns? Delegate Shalega, sorry.
So this bill allows nurse midwives to prescribe medication?
A starter dosage. Yep.
I'm sorry?
A starter dosage.
So I think we have a frequent opposition testimony from Maryland Right to Life about mifepristone. Did I say that right? Would this allow a nurse midwife to prescribe that? If it's a starter dose, probably not, but I thought I'd ask.
Yeah. I mean, I'm not a practitioner, but I don't think that that would qualify as a starter dosage of a drug under these circumstances.
Yeah, okay. Nick, you've delivered babies. Sorry, thank you.
Okay. Any other questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition to the bill? Seeing none, if you don't want to be on the bill, can you raise your hand? Delegate Shalega.
I might change my vote on the floor if I want to be.
Okay. Okay, so I have Delegate Shalega, Delegate Chisholm, Delegate Morgan, Delegate Riley, Delegate Hutchinson, and Delegate Kipke. I'm going to have to assign that to someone else because I gave that to to one of you, that bill. So at the end of this, we'll stay put. We'll have to reassign it, okay? We'll go through it and you could tell me whether you're comfortable or not, okay? So let's go to House Bill 809. And that is State Procurement Minority Business Enterprise Programs Extension and Report. It's Lindsay and Delegate Kurt. Lindsay, can you explain the bill and the amendments, please?
This bill extends the termination date by 1 year to July 1st, 2024 for the authorization of minority business enterprise preferences for procurements relating to offshore wind projects and video lottery terminals to align with the termination of the statutory authorization for the state's MBE program. It also extends the deadline for the completion of the MBE program's disparity study by 3 months to December 30th, 2023. Finally, it aligns the deadlines for related disparity studies or analyses for offshore wind projects, public-private partnerships, capital projects that receive state bond proceeds, and pension system investment brokers and managers with the new deadline for the completion of the MBE's program's disparity study. There are amendments on page 56 of your packet that make a technical correction regarding the extension of the report regarding offshore wind projects and extends the authorizations and deadlines related to the state's MBE program.
Okay, and that is Delegate Kurt.
Thank you, Madam Chair. This bill passed unanimously out of subcommittee. Also, it has passed the Senate 47-0, and it's already crossed over. I move the amendments.
All right, so the amendments have been moved and second. Are there any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, on the bill as amended?
Move the bill as amended.
It's been moved and second. Any questions or concerns on the bill as amended? Seeing none, all those in favor say aye.
Aye.
Any opposition? Seeing none, who does not want to be on the bill? Can you raise your hand, please? Everyone wants to be on it. Let's go to House Bill 809. Oh, no, that's the one we just did. Sorry, 811, hospital overdoses testing for fentanyl. That's Aaron and Bagnall.
This bill requires a hospital to include testing for fentanyl if an individual is treated at a hospital and the hospital conducts a urine drug screening to assist in diagnosing the individual's condition. A hospital that does not have chemical analyzer equipment is exempt from the requirement. There are amendments on page 61 of your packet that were adopted in Public Health and Minority Health Disparities Subcommittee. The amendments alter the bill title to be the Josh Symes Act. They strike language in the bill requiring a hospital treating an individual with a known overdose to conduct a rapid urine drug test for the presence of fentanyl. Requires the hospital to report the de-identified test results to MDH through the state-designated health information exchange and clarifies the immunity provisions in the bill.
Delegate Bagnall.
Chair. Sorry, I keep touching it. This was, the subcommittee really liked this bill once we understood it, because it does two things. It shares the information with the care team, but de-identifies it for the purposes of reporting. And with that, it was unanimous, and I move the amendments.
Second. It's been moved in second. Any questions or concerns on the amendments? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, on the bill as amended. It's been moved in second. Are there any questions or concerns on the bill as amended? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none, does anyone not want to be on the bill? Can you raise your hand? All right, everyone will be on it. House Bill 816, Procurement, Minority Business Enterprises, and Veteran-Owned Small Business Enterprises. Participation Goals Scorecard. That is Lindsay and Delegate Kurt. Lindsay, can you explain the bill and the amendments, please?
As introduced, the bill requires the Governor's Office of Small Minority and Women Business Affairs to develop a scorecard to evaluate state agencies on their performance toward meeting the state's Minority Business Enterprise Participation Goal, MBE sub-goals, and Veteran-Owned Small Business Enterprise Goal. The amendments that begin on page 63 of your packet strike the requirement that the scorecard include MBE sub-goals. Rather than specifying a grading scale, requires the scorecard to include a grading scale developed by GOSBA as a weighted scale that includes each unit's contribution toward meeting the statewide MBE goal and VSBE goal, and requires the scorecard to be posted on GOSBA's website. Those amendments, as I described them, were adopted in the Government Operations Subcommittee on page 64 in your packet. I've noted that the Budget and Taxation Committee and the Senate adopted the same amendments on the Senate cross-file, but also required GOSBA to also submit the information that they've posted on their website to the General Assembly within 30 days after posting it. So I wanted to put that all out there to you all for consideration. That was adopted in B&T after the subcommittee met on this bill.
Delegate Kurt, and thank you, Lindsay, for your work on that. Delegate Kurt.
So we had Delegate Phillips, the bill sponsor was in subcommittee, and he was agreeable with GOSBA's LOI request. We also adopted an amendment to conform to the Senate version, but the thing, we haven't acted on the B&T that's happened after that, or we have?
Just after that discussion in subcommittee, B&T added that piece about what gets posted on the website also being submitted to the General Assembly within 30 days. The impetus behind that is the idea of sort of memorializing what is posted on the website. There's a record then, it would go to the DLS library, someone could look up what had been there, because websites evolve over time.
Okay, do you want to move the amendments?
Yeah, I'll move the
All of
amendments.
them?
All of them,
Including
yes.
the B&T one?
Including the one we just mentioned.
Let's just now open it up for discussion. Does anyone have any questions on the amendments, including the new one? Seeing none, all those in favor say aye.
Aye.
Any questions or concerns? All right, any opposition? Seeing none on the bill?
Move the bill as amended.
It's been moved in second. Any questions or concerns on the bill as amended? Seeing none, all those in favor say aye.
Aye.
Any opposition? Who does not want to be on the bill? Can you raise your hand? All right, everyone will be on it. Let's go to House Bill 817, State Government Regulation Procedures and the Maryland Register. That was favorable with amendment. It is Lindsay and Delegate Kurt. Lindsay, please explain the bill and the amendments.
This bill makes various changes to the processes and procedures for units of state government to submit regulations to the Administrator of the Division of State Documents, the Joint Committee on Administrative, Executive, and Legislative Review, and the Department of Legislative Services. Among other things, DLS must adopt procedures for the required submission of proposed and emergency regulations, work plans, and evaluation reports. The Administrator must consult with DLS to ensure that the notice of the receipt of proposed and emergency regulations is submitted from the Administrator to AELR and DLS in a timely manner. By October 1st, 2023, as originally introduced, the Administrator must develop and maintain an electronic filing system for use by units of state government, AELR, DLS, and DSD for the submission and tracking of proposed and emergency regulations. And the bill specifies that DSD must make at least the 15 most recent issues of the Maryland Register available on its website. On page 65 in your packet, you have amendments from the subcommittee that require DO-IT rather than DSD to develop and maintain the electronic filing system. And I will also note for everyone that you have a loose piece of paper marked as page 83 with an additional amendment to be offered by Delegate Rosenberg because, again, the Senate adopted something slightly different than what was discussed in subcommittee.
Okay, so why don't we go to Delegate Kurt and explain to us
This moved quickly in subcommittee and passed unanimously, so I would move all the amendments.
It's been moved in second. Any questions on all the amendments? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none on the bill as amended. Oh, wait 1 second.
I hope I'm not too late.
Yeah, Rosenberg, he moved all the amendments, including yours.
Oh, you did include mine, which changes?
Yes.
Oh, I'm sorry. I wasn't
It's
listening
okay,
well
no,
enough.
this is the place to ask the question. It's okay to slow me down.
Actually explain that amendment because I was leaving it to Delegate
Okay, why don't,
about it, but do you?
it's you know what? Let's go, let's slow it down a little. Can you, Delegate Rosenberg, go ahead and discuss the amendment.
Well, the change that the difference between what the subcommittee did as a subcommittee and what the Senate did as a full body now was the Senate did not have substantively that the amendment or that the difference between the first version and the subsequent version had to be substantive. So as what's been adopted by the subcommittee and proposed here, the two bills would be in conformity, and that's the ballgame. We're done with this legislation. Assuming it passes on the floor.
Okay,
Shouldn't take that for granted.
all right. Any questions on that? All right, so again, move the bill as amended again, with all the amendments again. The bill has been moved with all the amendments. It's been second. Any questions or concern? Seeing none, all those in favor of the bill with all the amendments, say aye. Aye. Any opposition to the bill with all the amendments? None. And who does not want to be on the bill with all the amendments? Everyone wants to be on it, great, okay. Okay, let's go to House Bill A63, Public Health Chief Medical Examiner Corrections 2, Aaron and Bagno, and it was favorable.
The bill extends the time period within which a person in interest may request the medical examiner to correct findings and conclusions on the cause and manner of death from within 60 days to within 180 days after the medical examiner files those findings and conclusions. There were no amendments.
Okay, and that's Delegate Bagno.
We did have a discussion on this because there was a request from the ACLU to lift the restriction entirely. This bill was the compromise, and the sponsor asked us to resist any amendments, so I would move the bill. And it was unanimous, so move the bill.
Second. It's been moved in second on the bill that is favorable. All those in favor say aye. Aye. Any opposition? Seeing none, the bill passed in committee. House Bill A69, Department of the Environment Study on Death Care and Funeral Practices, favorable with amendment. It is Aaron and Bagno. Aaron, can you explain the bill and the amendments?
Yes, the bill requires the Maryland Department of the Environment, in consultation with the Maryland Department of Health and Maryland Department of Labor, to conduct a study on the impacts of death care and funeral practices on the environment and public health in the state. There is an amendment in your packet that was adopted in the Public Health and Minority Health Disparities Subcommittee that strikes provisions in the bill that required the study to include a certain analysis.
Delegate Bagno.
With the amendments, it significantly brought down the fiscal note. The bill passed not quite unanimously.
Okay, so.
Move the amendments.
Second. So they've been moved in second. Any discussion on the amendments? Seeing none, all those in favor say aye. Aye. Any opposition? You want? No, sorry. Okay, seeing, on the amendments? No. Okay, so on the amendment, okay. Okay, so there's no opposition to the amendment. On the bill as amended, is there a motion?
Move the bill as amended.
Second. It's been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition, can you raise your hand? Delegate Shalega, Delegate Chisholm, Delegate Morgan, Delegate Riley, Delegate Hutchinson. Okay, all right. Who does not want to be on the bill? Can you raise your hand? Okay, Delegate Shalega, Delegate Shalega, Delegate Chisholm, Delegate Morgan, Delegate Riley, Delegate Hutchinson, and Delegate Kipke. All right. So we are now on, we're almost done, guys. House Bill 962, Physicians and Allied Health Professions, Reorganization and Revisions. It is favorable, and it is Lindsay and Rosenberg. Lindsay, can you explain the bill?
This bill generally consolidates and reorganizes provisions relating to physicians, physician assistants, and allied health professions regulated by the Maryland Board of Physicians, and codifies regulatory requirements, repeals obsolete provisions, and makes provisions consistent across the regulated professions. There are no amendments.
Delegate Rosenberg.
And the bill is is identical to a bill that passed the House unanimously last year. So it was unanimous in the subcommittee, and there are no amendments, so I would urge a favorable.
Can you move the bill, please?
I so move the bill, sorry.
It's been moved in second. Any questions or concerns? All those in favor say aye. Aye. Any opposition? All right, thank you very much. House Bill 977, Maryland Department of Health Office. Oh, we did that? I'm sorry. All right. So 1051, Public Information Act, Decisions of State Public Information Act Compliance Board and Appeals. Favorable with amendment, Lindsay and Kurt. Lindsay, can you explain the bill in the amendments?
This bill authorizes a party who's aggrieved by a final judgment of a circuit court in a proceeding for judicial review of a decision issued by the State Public Information Act Compliance Board to appeal to the Appellate Court of Maryland. The amendments on page 69 of your packet clarify that both requesters and custodians have the right to appeal from Public Information Act Compliance Board decisions in appropriate circumstances.
And that is Delegate Kurt.
Thank you, Madam Chair. I don't have any notes, so I assume that it went smoothly through subcommittee and passed unanimously, so I move the amendments.
Are there any discussions on the amendment? They've been moved in second. Any concerns? All those in favor say aye. Aye. Any opposition on the amendments? Seeing none, on the bill as amended. It's been moved in second. Any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Who wants to be on the bill? Who does not want to be on the bill? Can you raise your hand? All right, everyone wants to be on it. May we go now, please, to House Bill 1146, Maryland Medical Assistance Program Adult and Pediatric Dental Services Review of Reimbursement Rates. And that's Aaron and Bagnell.
There are amendments on page 71 of your packet that were adopted in Public Health and Minority Health Disparities Subcommittee that strike the bill and become the bill. The amendments require the Maryland Department of Health, in consultation with the Maryland Hospital Association, to conduct a specified survey of hospitals, requires the MDH and the Maryland Healthcare Commission to conduct a regional needs assessment for dental procedures that require anesthesia or moderate sedation, and requires the Maryland Department of Health and MHCC to develop regional plans to ensure the availability of appropriate operating room space for the performance of dental procedures for Medicaid recipients. On or before December 1st, 2023, MDH and MHCC must report the results of the survey, needs assessment, and regional plans to the Senate Finance Committee and the House Health and Government Operations Committee.
Delegate Bagnell.
Thank you, Madam Chair. This bill, we did have discussions on a potential second amendment. We realized we weren't there yet, so we moved the bill as amended unanimously, so I would move the amendments.
Second. They've been moved in second. Any questions or concerns on the amendments? Delegate Shalega.
So I guess on the amendments, but also on the bill in general, did you guys include the anesthesiologist, the whole care team in this? Or is it just the Department of Health and the Hospital Association? Because this is also ambulatory surgery centers.
Delegate Bagnell. Oh, Aaron. Oh, okay.
Ambulatory surgery centers are included.
And how about the rest of the anesthesiologist? I mean, I heard the word anesthesia, but I didn't know if they got a seat at the table for the reporting.
It didn't necessarily go to the providers as much as the facility. I mean, there is, if you look under, in the bill, it does discuss stipends paid for anesthesiology services.
Where it does say that? Which page is that on?
72, subsection A, 5.
And if I may add a little to the discussion, Delegate Shalega, I received a call from Barbara Brocato and Bill Chester. And Barbara drafted a letter where I agree to support her request. She went to it was too late to make the request for I think it's $2 million here in the House, but she went over to the Senate and she's talking to them about putting the money in the budget for the rate increase, and the chairman of appropriations said that he would do it if the Senate puts it in, because it was too late for ours, and I said that I would support it. So she gave that in writing and have been speaking with Budget and Tax.
Is that a one-time, or are we?
That is every year, and we get 50% from the feds as well.
50% of commercial charges?
Yes.
Okay, and if they don't do that, I think we'll need to look at it next year.
Absolutely.
Because the problem, again, as I you probably recall at the bill hearing, I mean, I worked on this 10 years ago, and we said this was going to happen.
Yeah.
And I'm so sorry we were right. And
Well, I got your-
excluding them
yeah.
from the conversation is not going to solve this problem.
So I got your note, and that's why I agreed to be quoted in the letter that I
Okay.
was okay. And Chairman Barnes said that he would be all right if the Senate puts it in the budget.
Okay, thank
Okay?
you.
My
Thank you,
pleasure.
Madam Chair.
Thank you for the questions. Yes, Delegate Hill.
And I'll come back later when we get on the bill, but to Delegate Chalega's point on 72, at the bottom, B4, it does say the ability, so they're going to study the ability of ambulatory surgery centers to pay stipends to anesthesiologists related to dental procedures. All right?
Yeah.
And then I'll come
Thank
back.
you. Thank you. Any other discussions on the amendment? And it's really an important issue, so Delegate Kipke, thank you for your leadership on it. On the amendments, all those in favor say aye. Aye. Any opposition? On the bill as amended? It's been moved in second. Any discussion? Delegate Hill.
Yes, so as Delegate Chair Bagnell alluded, we were looking at trying to put the study of operating room space. I sent the study from 2020. Let me just back up. We have been looking at the use of hospital space, which is regulated, for unregulated procedures, which includes cosmetic procedures, but is not exclusively that. In 2019, the bill died sine die. The chair wrote a letter. HSCRC did a report. And the report came out. I never saw it. I don't know who else saw it. But they then suggested that they go ahead and do what the bill had asked, was a pilot study. And they had two different pilot ways of doing it. One was too problematic, the other wasn't. Then COVID hit. And at the end of the study, what they said is, we would like to go ahead with the study, but because of COVID, we can't. The folks have come back and said, we still need that study. So I asked Megan, so Megan came in, Megan Renfrew for HSCRC, came to subcommittee and basically said, I'm not sure what we need. And when I talked to her about the report and said, conversation today, well, can't you just go ahead with the study, which you said you would do after we got through the pandemic? Her response was, well, we don't know if the hospitals still want it. I responded, but in your report, you said you would resurvey the hospitals and let us know. And that's where we left it. And I know I'd send an email to the chair, copied you, copied Aaron, because it may be that without an additional amendment, we can ask them to follow through. But what she said is they don't have the bandwidth. They don't want to do it. They don't believe it's a cost problem. And I've spoken to Gene Ransome Medkai. He says it is a problem, and it's been a problem for over 10 years. And so I guess what I'm bringing it up as, if whether Aaron feels that given the report, if we as a committee decide to push this issue, do we need an amendment, in which case I would ask to hold the bill a day or till the next voting session? Or would we be able to move ahead simply because they said before they were willing to do a pilot study? So it's really a question of council and chair, because I think it's important.
Yeah, I think that I'm going to let, actually, Delegate Kipke, go ahead and then I'll speak. Or you want me to go ahead and address it?
Yeah, I was listening.
Okay, no problem.
Because I know.
Okay. Delegate Hill, while I understand what you're trying to do, this is such an important bill that I don't want it to die across the street because we put this, right? Although it's not last minute per se because they knew about it, but it's last minute because it hasn't been part of our discussions. Every Friday, we've been meeting for 2 months, every single Friday at 5 o'clock in the afternoon. So I don't want to kill it, and this is really important, and it took a lot to be able to get us to do this bill. So what I can promise you is that I will bring them to my office, and you can be present, and I will ask them to do it. Okay? Will you take my word?
Said that they were going to go ahead and do it. So I don't, so part of my discussion was, do we even need to amend this on it?
You don't, because they said they were gonna do it, so
But
what we need to
What they're
do.
saying now is they won't, and so I will take
So,
your
but-
word that we'll work with them and make
So
them
we
do
need a
it.
conversation, right? I need to bring them to my office gently, kindly, and ask with a lot of honey. Can we try the honey first?
Sure, that was
Okay.
my question. I
Not
was-
my cheesecake, but the honey.
But I'm bringing,
Not my cheesecake though, but the honey, okay? Yeah. You're not in the weekly review, okay. Michelle, can you please request a meeting with Delegate Hill, the Hospital Association, and myself? Is it, whoever it is, just go ahead, okay? Adam Kane. And staff, okay? Okay. All right. Thank you. So where were we? Were we on the bill as amended or? On the amendments, right? We're on the bill. Okay, any other discussion on the bill? And thank you, Delegate Hill, and I will follow up with the meeting, okay? Thank you, Michelle. On the bill as amended, all those in favor say aye.
Aye.
Any opposition to the bill? Who does not want to be on the bill? Can you raise your hand? All right, everyone wants to be on the bill. Thank you, everyone, for your work on this. Let's move on to House Bill 1149, please. And that is Medical Waiver Program Waitlist and Registry Reduction, end of wait. Favor with amendment, Aaron and Bagno. Aaron.
The bill authorizes funding provided in the fiscal 2023 budget for autism waiver expansions to instead be used more broadly for Medicaid waiver expansions. There are amendments in your packet that were adopted in Public Health and Minority Health Disparities Subcommittee that specify that provide that a specified portion of the fund shall be used to provide community services to individuals waiting for services through the Community Pathways Waiver, Community Supports Waiver, Family Supports Waiver, Brain Injury Waiver, Home and Community-Based Options Waiver, Medical Daycare Services, and Model Waiver for Medically Fragile Children, and the Autism Waiver. A portion of the funds may be used for the purpose of expanding provider capacity in the waivers, including hiring and retaining staff.
Bagno.
This was a unanimous vote. I would move the amendments.
Are there any concerns with the amendments? Yes, Delegate Chisholm.
So I did end up voting for it, but I did have concerns because if you look in the amendments, what it does is it takes the budget, and originally the budget said that there was $30 million to go towards autism waivers. And it gets changed to Medicaid waiver expansion. Further down in the bill, or in the amendment, it says, okay, there's 10 million that's going to go to autism waiver and a 20 million to be used other places. And I asked, I can't remember who was there for the budget, but it was never clear to me that we were going to allocate enough money for that autism waiver. And I say that because we have bills in here all the time for the autism waiver and for autism advocates. I just want to make sure that they are not going to get shortchanged, if I can, on this bill and with this amendment of being kind of cut out, intentionally, unintentionally, I don't know. But obviously, there was a reason there was $30 million in the bill originally for autism waiver, and I'm still not completely clear on why it got divided up like it did. And I just don't want the funds to be misallocated away from them.
Okay, Aaron?
So it does say in the fiscal note that at least 10 million of that 30 still has to go to MSDE for the autism waiver. So 10 of the 30 is still strictly for the autism waiver.
That's a 66% cut.
And what the bill does is, but then of this 20, the autism waiver is still included. among the waivers listed.
So there's 8 waivers. They're one of the 8. In the 20, they're still included, plus they get that extra 10.
Well, it wouldn't be an extra.
Not extra, it's,
Originally, they started with 30 million, now they're down to
Right.
10, and now you're going to be split up between 8.
because, and the bill was for all of them. When I gave testimony last year and we allocated $40 million, it was for all the waivers. So the autism waiver is not going to get shortchanged.
I'll take your word for it.
And the disability community and everyone, they're all supporting it.
Okay.
There's no one dissenting. They agree with it. Yeah.
Issues they have is that people will age out of the autism waiver, but they want to make sure that they still have continuity of services. They want to make sure that they have some level of flexibility in terms of staffing and retaining care providers. So they were asking for this flexibility, but it's the community that's actually asking for the flexibility. So we won't be shortchanging the community.
Yeah. And you know, if you notice, this is the only bill that you have seen that I have had, right? And because it's really, as you said, is so important, right, for the disability community. But they just want to be flexible and be able to have money to hire people. Any other questions or concerns? All right. All those in favor of the bill, say aye. Aye. Any opposition? Seeing none, who does not want to be on the bill? Okay, everyone wants to be on the bill. So let's go to House Bill 1156, pharmacist therapy, management contract formed, favorable with amendment, Lindsay and Rosenberg.
This bill authorizes a therapy management contract to be entered into orally or in writing, including in electronic form, and stipulates that if entered into orally, the contract must be reduced to writing by the parties. The amendments that begin on page 76 in your packet require a therapy management contract entered into orally to be reduced to writing within 30 days after entering into the contract.
That amendment from the sponsor was crucial to getting the support of the, I think, MedCai, and the bill as amended was supported by all the parties, unanimously supported in the subcommittee. I would move the amendment.
It's been moved in second. Are there any questions or concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none on the bill? It's been moved in second. Any questions or concerns on the bill? Seeing none, all those in favor say aye. Aye. Any opposition? Who does not want to be on the bill? Raise your hand. Everyone wants to be on it. Let's move on to House Bill 1159, State Board of Dental Examiners, University of Maryland School of Dentistry, faculty qualifying for examination. That is favorable with amendment. That is Lindsay and Rosenberg. Lindsay, please explain the bill and the amendments.
The bill is introduced, altered the requirements that a faculty member of the University of Maryland School of Dentistry trained at a foreign dental school must meet to take an examination offered by the American Board of Dental Examiners. The amendments that begin on page, I think I wrote 77, sorry, of your packet. Restore the existing requirements for a faculty member trained at a foreign dental school to meet to take the ADEX, and additionally authorizes a faculty member trained at a foreign dental school to be qualified by the board to take the ADEX if the applicant is a general dentist who has successfully completed a general dental practice residency or advanced education in a general dentistry program and is board certified by the American Board of General Dentistry.
With this amendment, it was unanimous among the parties and then unanimous as amended by the subcommittee. I would move the amendments.
It's been moved in second. Are there any questions on the amendments? Any concerns? Seeing none, all those in favor say aye. Aye. Any opposition? Seeing none. It's been moved in second. Any questions or concerns? Delegate Shalega.
Why do we need this bill? Tell me what it does, Delegate Rosenberg.
Well, it provides a pathway for people who have their degree from out of the country, and the procedure as amended is satisfactory to the dental community.
But if they've completed all the stuff on page 77, it seems like why would they need the, what is the hurdle they haven't crossed with this amendment on 77 that, I'm confused.
May I let
Counsel.
The piece is that they're a general dentist. The provisions already allowed for someone who's trained in a dental specialty recognized by the State Board of Dental Examiners, and this is for general dentists.
So it allows a person who is a dentist trained somewhere that's not in the United States to teach at the dental school if they do all these things on page 77.
Delegate Collison.
Thank you.
Okay.
I'm going to try not to. No, it's not about teaching. They're already teaching there. In fact, the bill says they have to have taught at the dental school for 7 years before they are eligible to practice dentistry outside of the school of dentistry. And what this bill does is allow them to apply for a license if they meet those requirements and that are specified in the bill, and they've taught at the dental school for at least 7 years. We did this last year for specialty dentists, as Lindsay just said, but we neglected that there are actually people who are teaching at the dental school who are trained, who are general dentists and not specialty. So it's really about our ability to recruit dentists, to recruit educators, but who want to keep a practice aside from their education responsibilities.
Okay, thank you.
Okay, any other questions or concerns? And where was that, on the bill, right? All right, all those in favor say aye. Aye. Any opposition? Seeing none, who does not want to be on the bill? All right, everyone wants to be on it. And we have our last bill of the day. It's House Bill 1160, and that's Maryland Pathway to Nursing Program and Advisory Committee establishment. Is favorable with amendment. It is Lindsay and Rosenberg. Lindsay, explain the bill and the amendments, please.
This bill establishes the Maryland Pathway to Nursing program in the Department of Health to provide practical and financial support to specified nursing students. The bill also establishes the Maryland Pathway to Nursing Advisory Committee to assist the Secretary in the development and implementation of the program. By December 15th, 2023, and annually thereafter, the Secretary must report to the Governor and General Assembly on the implementation of the program. There are amendments on page 78 in your packet, adopted in subcommittee, which require regulations adopted by the Secretary to include a requirement that program participants sign an agreement that they intend to practice in the state for at least 2 years, adds a representative from the Department of Labor to the committee, and requires the committee to submit a report on or before December 1st, 2024 on whether licensed practical nursing education programs that meet educational program requirements under Title VIII of the Health Occupations Article, that's the nurses statute, may be eligible for federal and state funding related to apprenticeship programs.
Delegate Rosenberg.
The subcommittee felt that the language, the one specific change requiring that someone in this program must practice in Maryland for 2 years was very consistent with our goal this session of addressing the workforce shortage. And so that was unanimous on the subcommittee for the amendments and for the bill as amended.
Are you gonna?
I would move the amendments.
It's been moved in second. Any questions on the amendments or concerns? Delegate Shaliga.
So I think we learned from our briefings that a big part of the shortage in nursing is lack of nurse educators. Does this do anything? I mean, we have like I'm making these numbers up. 100 people apply for nursing school, 50 of them get in. So we don't have a lack of applicants for nursing schools. What we have a lack of is educators in the nursing program. So does this do anything for that? And if not, why not?
I'll let the sponsor of the bill address it, and then Delegate Bandari, I'll call you.
Thank you, Madam Chair. So the way this bill deals with it is it's a pathway. It's not about going into nursing school. It's taking folks who are certified nursing assistants, who are currently working as certified nursing assistants, and taking them into community colleges, and where there is a program that will support them in becoming licensed practical nurses, LPNs.
Okay.
And then they can choose to go to nursing school after that if they want, but we need those LPNs as well. So, and the beauty of the program is, what we discovered is that folks who are trying to go from being a CNA to an LPN either couldn't afford community college, or, had childcare responsibilities or transportation issues, and this pilot is designed to provide those wraparound services so that they can be successful, become LPNs, and then our hope is that a number of them will go on to be RNs, but we still need a good cadre of LPNs.
Yes, we do. Okay, I understand. I know we have a similar program in Baltimore County.
That's the model.
That's the model. Okay, thank you.
Your program is impressive.
Yeah.
Seriously. And I hope many other counties do it as well. Any other questions on the amendments? Delegate Bandari, I apologize.
Yeah, no worries. Delegate Colucci explained it. I believe one of the priority of the program would be childcare will be the priority, right? That's what
One of the wraparounds.
Yep.
Okay. Delegate Rosenberg, you want to discuss the
I would just say, in response to Delegate Zaliga's concern, that one of the enumerated aspects of the program that the Secretary of Health is to evaluate is the resources necessary to support the pilot program. So that would include teaching, those who would be teaching.
Okay. Anyone else? Okay. Sure.
That when they're looking at the geographically diverse areas, they look at Prince George's County.
Okay. Did you hear that? Okay. Prince George's, gorgeous Prince George's, we have to work on them. Anyway, any other questions or concerns? All right, all those in favor say aye on the amendments. Any opposition? Seeing none on the bill as amended, is there a motion? It's been moved in second. Any questions or concerns? No? All right, all those in favor say aye. Aye. Any opposition? None. Who does not want to be on the bill, raise your hand. All right, we finished the work for today, but please stay seated for a second. We finished the work for today. Thank you so much for your attention. For the OLAs and staff, thank you for all your hard work. We really appreciate you. Thank you. And can you take us off and let me know when we can speak? 1 second, please. Can you take out a piece of paper and a pen, please? And I'm going to make some assignments. If you're not comfortable with the bill, let me know. I need you to read it tonight. I need you to watch the voting session. I need you to study it. This is the time on the floor where things go really crazy and you may be asked questions, okay?